Overall, what we found since Francis is that the recommendations have been a real catalyst around our 6 C's and our compassion in care agenda. So what I've seen occur on wards is a real commitment to delivering care with kindness. With that, overall what we've seen is a highly visible senior board. So our board members have been out and about, walking around. We have been talking around care in very different terms, using very different language. We've developed a pledge around our staffing. Our ward sisters are committed to reducing and eliminating harm. So a year ago, words like harm would have made people very defensive. However, nursing staff actually talk about harm and how they can mitigate it and prevent it happening again. I think with most organisations, it's a change in culture. I think the NHS has had a very medical model. I think Francis has asked us to question that model and make patients the focus of care. It's around empowering teams and to empower patients and to get the right for patients by listening to what patients need. So I think the biggest challenge for us is how we make time to let that happen. I think again it goes back to time, and it goes back to other resources such as having the patient in the right bed under the right physician and having the physician at the patient's bedside rather than the patient having to go to the physician. For our nursing and medical teams and clinical teams, within our trust we've focused on the clinical team approach. It's about enabling them to have that time at the patient bedside to move things forward. And I think again that will be one of our biggest challenges. Actually reading the Francis report and taking in the recommendations has given us courage, and I think that has been the difference for us. So we've had a very operationally led service. We're now taking that back clinically and putting in that challenge back to the board about what we feel we need. And for us in our trust, our board has responded.